Hi, I'm still student nurse. Today's topic, I want to talk about colorectal cancer or bowel cancer. Understanding bowel cancer is important to reduce risk of mortality related to cancer in the bowel and disseminate the information to other people for mindfulness awareness of their lifestyle choices and also seek prompt interventions as well. So let's begin about the definition. But before we begin, I wanted to explain the purpose of this presentation is to understand the definition, the symptoms, risk factor, pathophysiology, the diagnosis, treatment, and preventative care of colorectal cancer. So what is bowel cancer or colorectal cancer? Colorectal cancer, or it's also known as a bowel cancer, it's the abnormal growth or malignant tumor inside the colon and parts of the rectum. The malignant tumor develops into adenomatous polyps inside the lining intestine. Polyps can be harmful, and some types of other polyps can also be dangerous, and some types of polyps can be harmless. So it depends on the types of polyps, but when polyps formation, the bowel becomes blocking inside the colon and it causes inflammation. And those malignant tumor cells can evolve into serrated adenomatous polyps. It's another specific type of polyp inside the mucosal layer of the colon and potentially protruding. So the cellular change may trigger genetic mutation and that causes cancer metastasis. So how does the colon cancer spread? Colon cancer spreads through the bloodstream, the lymphatic system, or by the direct invasion into surrounding tissues. Common site of the colon cancer spreads to liver, lungs, brain, bones, and peritoneum. So before we begin to know what are the risk factor, symptoms, and pathophysiology, I wanted to explain a little bit about what is adenoma. Again, adenoma is there's like two types of the tumor cells. So again, beneath cells is non-cancer cells. It's motile, so it can move. However, beneath tumor is a non-cancer cell. It can also develop into malignant tumor over time. And then another type of tumor cell is called malignant. We also know it as a cancerous cells. It's immobile, and these tumor cells are antagonists to natural killer cells, have T cells, and macrophages of DNA defense elites. So malignant tumors then develop to cancer. So adenoma is a type of benign tumor. So it's not a malignant tumor, it's a benign tumor. It's non-cancerous cells, and it originates in the glandular tissues. And glandular tissues can be found in anywhere in the lining of the body, like breast, stomach, colon, etc. And adenomas, there's types of adenomas. Tubular adenomas, it has a small tube-like and rounded shape characteristic. Whereas adenomas, it shapes like a cauliflower or shaggy-like pattern. It's often like a finger-like rejection. And tubular villus adenomas is a mix of tubular and villus characteristic. So it looks like a finger-like rejection, but it's small, tube-like, and rounded shape. And then the other one is serrated adenoma. This one is a dangerous one. It's a polyp sawtooth appearance, so it appears like a sawtooth, and it can cause major cellular changes. So these benign cells, benign tumor is non-cancerous, but serrated adenoma types, it can cause cellular changes. So what is polyps? A polyps is referred to protruding inside the lining of the body part. It's like a growth protruding from a membrane lining a body part. Polyps are harmless, but some polyps can be cancerous or it has potential to develop into cancer over time. Different types of polyp exist based on its shapes, location, and the cells that it made of. With some being like develop into cancer than the others. So there's different types of polyps. We have sessile polyps. Sessile polyps it has a flat characteristic shape. It's barely raised polyp that stick out without a stalk. And then we have pedunculated polyps. It raised polyps attached to a stalk and resemble like a mushroom shape. And then adenomatous polyps. It's a type of polyp that develop cancer. And then hyperplastic polyps is a harmless polyps, so it's not a cancerous polyp at all. And then serrated polyps, it's also developed into cancer because it has a sessile serrated lesions and traditional serrated adenoma. So it's like a combination of sessile polyps and adenomatous polyps. So we call it a serrated polyps. So let's get to know the symptoms of colorectal cancer or known as bowel cancer. So the symptoms includes diarrhea, with or without the blood, vomiting, nausea, weight loss, dehydration, abdominal pain, usually in the lower left quadrant of the abdomen, and rectal bleeding, muscle pain, arthritis, tachycardia, like fast heartbeat, anemia, like loss of red blood cells, hemorrhages, like bleeding, and skin necrosis, dryness. The complication of bowel cancer can link to diverticulitis, Crohn's disease, ulcerative colitis, perforation, severe hemorrhage, and loss of consciousness. So these are all linked comorbidity to the colon cancer, or known as bowel cancer. Colorectal cancer, the risk factors. The risk factors may develop linked to unhealthy lifestyle of prolonged physical inactivity with unhealthy diets, like consuming junk foods or contaminated food and water, and experience obesity in lifetime and ignoring behaviors like not seek treatments, having family history of cancer, that's also linked to bowel cancer too, and born with inherited genes like BCRA1 and BCRA2 genes. They are prone genes to develop cancer, and the person is lacking of preventative care, maybe because of social demographic factors that affects lower income and lack of preventative knowledge, and then conjunction to their alcohol and smoking behavior. So these are also the risk factors of developing bowel cancer. I want to explain about stages of cancer before we move on to pathophysiology. And there are six stages of cancer. Stage 0 is when abnormal cells found in the innermost lining of mucosa of the colon or the rectum. The abnormal cell multiplies. Multiplication of the abnormal cells starts its division and become uncontrollable and then invading. But in stage 0, it's just like a detection of malignant tumor. And then stage 1, cancer grows from mucosa to colonic muscle layers, and these part tumor enlarge, and the medication is required. Stage 2, cancer has grown through the muscle layer and sersa of the colon wall, and it does not spread to the nearby organs. However, medication and therapy might need it. And then stage 3, cancer spreads through mucosa and submucosa, and then colonic muscle layer, lymph nodes, and the nearby tissues. In this case, it's locally advanced, so it's spread to the nearby organs. And surgeries, therapy, and medication are needed. And then stage 4 is when the cancer spread to the blood, the lymph nodes, and nearby organs like lung, liver, abdominal walls, etc. It's when stage 4 it spread severely, spread into the bloodstreams. It infected any other organs, and that's when emergency calls. And then the last step is the stage recurrence. It's a stage number 6 or stage recurrent. It's when the cancer has been treated or underwent any type of surgeries, and then it returns after a period of time. So like after recovery during the remission period, the recurrent like symptom is occurring, so it comes back in a period of time and it returns in the colon, rectum, or abdominal tissues or any parts of the organs. So what is the pathophysiology of colorectal cancer? The pathophysiology of bowel cancer, it's due to abnormal growth of adenomatous polyp cells. Its malignant types, adenomatous polyp cells and serrated polyp cells, metastasizing into lymphatic system and surrounding tissue and organs, including liver, lung, brain, bone, peritoneum, well, bloodstreams. So simply, it can create it's a malignant tumor that develops, and then it transforms into adenomatous polyps, adenomatous, and it abnormally grow and enlarge and uncontrollable, and the inflammation of polyps occur inside the colonic wall in the lining, and somehow it can block, causes bowel obstruction, blockage, or protrusions, and then there are alterations to genetic material because of the infection, and then it invasions into the surrounding organs, and then after that it's metastasis. So that's the pathophysiology. And what is the diagnosis of colorectal cancer? The diagnosis includes physical examination, abdominal palpation, and digital rectal examination. So to palpate the abdomen and the rectum to observe the nodule, the firmness of the cells, and then family history observation that we want to know like if the person had family history or family member relatives diagnosed with cancer before, or any history related linked to generational transmissions. And then fecal occult blood test or FIBT, it's a blood test collecting blood to observe the stool the infection severity in the stool and in the blood. Colonoscopy, it's imaging, capturing image. Sigmoidoscopy, again, also capture image at the sigmoid colon. Stool biopsy, when you collect stool to under microscope to test, and CT scans, MRI, they also like capture the image. And barium enema is another type of a specific type of X-ray for bowel inspection. So where in the needle incision insert and then following an X-ray. And then abdomen ultrasound and PET scan or positron emission tomography scan to capture images. So these are the diagnoses for bowel cancer or colorectal cancer. So what are the interventions? There are medical and nursing intervention. Pharmacological interventions include antibiotics, like administer metronidazole, and some sort of medication with adazole agents, like generic name envidazole. It's to prevent infection and lower the spread. And NSAID drugs also inhibit inflammatory responses. Blocker and inhibitor, these are medication to prevent and stop the spread for bowel cancer. Combined anti-adjuvants are those like an analgesic and antiemetic combined with opioid or non-opioid, and to stop nausea, vomiting, and pain at the same times. However, it has to be under drug instructions and nursing consideration. And fluid resuscitation and infusion to prevent dehydration and to pump for blood transfusion and electrolyte balancing. And surgery includes colectomy, remove the colon, bowel resections, also known as abdominoplasty. So that's specific for colorectal cancer, rectal surgery, laparoscopic surgery, adjuvant chemotherapies, and systemic chemotherapy. Radiation therapy is also important in this chemotherapy, like the 5-FU agents, like 5-fluorouracil agents for bowel cancer, immunotherapy, like a checkpoint inhibitor, and palliative care or rehabilitation care. So these are all the surgical interventions for colorectal cancer. And the nursing intervention include peri-operative care from the pre-hospital to post-operative, and include medication, pain, wound management, surgical preparation, educations, and inpatient outpatient system, and referral or escalation. So what are the preventative cares for bowel cancer? So it's encouraging healthy diet and lifestyles, encouraging hydration with liberal fluids intake of 3 liters per day, physical exercises, avoid smoking and alcohol, and hard solid food causing gastric discomfort, avoid medication that triggers side effect or constipation, talk to your GP or doctor about symptoms, have regular meals or with regular patterns, and avoid ignoring behavior if spotted symptoms. Regular bowel screening criteria highly recommended to participate to diagnose screening to see if the person is having bowel cancer or can develop any chance and the risk. So again, you can refer back to this presentation in the risk factors slides and then double check the risk factors and then compare with preventative cares so that you can seek intervention promptly or having preventative knowledge. So this pretty much all the presentation for bowel cancer or colorectal cancer, and references available upon request. Thank you for watching. If you like, please like and subscribe to my channel for more content related to health topic. And thank you for watching.